And there we are. Happy Saturday, Facebook. We're excited to be here. It's a beautiful day out. Thanks for joining. I know, April, I think you see there's like a viewer count also. So we're just waiting a moment or two for folks to join. I'm not sure if you see it or not. Like a little eyeball thing. Okay. So we're just giving it a moment for folks to join. I see some folks are viewing the feed. Really excited to be here. April, we're here with April Acock. She is a clinical coordinator at the U of R in the new adolescent program, which she'll share with us, which is super exciting. I see Mo. I just commented, hi, good afternoon. Really glad to have April here. Thank you so much. I've been super excited since you agreed to join in on this really important conversation. And we are going to be talking about racial disparities in substance use disorder treatment and recovery. What's been going on historically and kind of where we are now. So really important conversation, which hopefully there'll be more and more and more and more of. And April, again, thank you so much for joining. I'm going to hand it over to you.
Thank you so much for having me. I actually put it on my phone so I can see the people. I can't see it on here.
Oh, no.
Okay. I'm sorry?
No, I wasn't sure. This is all new to us still.
It's wonderful. It's wonderful. So thank you so much for having me, and hello, everybody. So yeah, I work for. So I just want to, just say a disclaimer. What I'm saying today, my views and opinions do not reflect the University of Rochester or any other entity that I may be affiliated with. This is all coming from my own personal experience. It is also coming from a little bit of research that I did do. I will say that I'm not an attorney, so when I start talking about some legal stuff, take it for a grain of salt, research it yourself as well. And I will provide some citations so that people are just aware and they can, do their own research. But I think it is very important to talk about the racial disparities when it comes to treatment. Hello. Good morning to you. This is so cool. Oh, wow. Okay, you guys can tell this is the first time I've done this. So what I wanted to do is, first I want to go back. We did, and I believe it was October, we opened up our adolescent young adult substance use program, which is a part of Strong Recovery. And we focus on populations from all racial ethnicity, but the age range is really from that 13 to about 24. We can take individuals who are younger, and we can take individuals that are older. We can also collaborate, of course, with our adult side if that's needed and do a warm handoff, which is also good with being able to continue to build relationships with clients. So really, we have a psychiatrist for people who need, psychotropic medication as they're going on their journey of recovery, as well as family services for the youth and young adults. So I'll say one last thing. The ideal for the adolescent young adult program was really to have a separate area because, as a lot of people know, the cognitive functioning is not fully there. The brain is not fully developed. And so we really wanted to not put young adults and adolescents into an environment where you are with individuals who may have been using for 10, 20, 30 years. So we really, and then hone in on specific needs for adolescents and young adults. That's my spill. So thank you so much for letting me be able to share that. I really do appreciate you.
Thank you. And this is the first program in our area that's specific to substance use and with adolescents in such an important age range.
I'm sorry, say that again?
Oh, this is the first program in our area of its kind.
But with the separation, you still have Unity that has some
Yeah.
services and Westfall Associates that have some services, and those are excellent services, and we collaborate with them as well. So I'll shout them out, to, yeah, we really wanted to focus specifically on this population here in Rochester. So yeah, so thank you. So I really want to go back to just understanding just the racial disparities when it comes to the substance use disorder world, which I fell in love with. I'll be very honest. I didn't want to work in substance use at all because substance use has it really um it, I have a lot of family members who struggle with addiction. And so I was able to unfortunately see a lot of the pain and hurt that my family members received, and also the lack of treatment. And for some of them, it was more of legal services as opposed to treatment services. And we'll go into a lot of that as I kind of give you everybody, the audience, just a narrative of a message that's being sent out to you guys, and you may not even be aware of this. So whenever you're watching, I don't know, and sometimes I like to be interactive, but Yana, if you're watching a TV show, right, and all of a sudden like a Snicker bar commercial comes on, and you watch it a couple times, you start thinking, oh man, I want a Snicker bar.
Mhm.
You know what I'm saying? Or you're like, oh, I'm suddenly thirsty. I want some Pepsi. It's because it's going within your brain and it's triggering something, it's sending out messages. And so there was a narrative that has been created when it comes to substance use services for Black and Brown population compared to the white population. Okay. Any
Mhm.
questions or thoughts?
No, no, I'm just listening to you, taking them.
So I'm going to do a quick just history. And so if we go back to July 14, 1969, this is where, and I'm going to paraphrase a lot of this, okay? So President Nixon, he goes to Congress and he's like, hey, we have a serious, serious, serious issue when nationally, it's a national threat. We are, having juvenile arrests, street crimes, and from 1960 all the way to 1967. We have to do something about it. And so he really was advocating for some kind of anti-drug policy on the state and federal level. Okay. Then you go and you see around 1971, that's when President Nixon says, oh, war on drugs. Now, during this time, you start seeing an increase of the Black and Brown community that unfortunately was, it was an epidemic with substance use. And so he says, oh, no, it's a war on drugs. And actually, it is public enemy number one. Pay attention to the narrative. So it's a war on drugs. We got a serious national threat. Okay. It's a war on drugs and a public enemy number one. All right. 1973, you go into the Rockefeller Law, which is saying, you know what? We're going to put these high penalties on people who are, have possession or are using, substance use and they get stopped. Then what happens is they're going to face a hefty sentence. So instead of putting individuals into a treatment center, remember, it's looked at as the war on drugs, public enemy number one, a national threat. Okay. And I'm going to keep using those words because that's a message that was consistently being sent out. Now you have Black and Brown people in communities that were getting 15 years in jail, in prison, or life for crimes that what when you look at it, it's like, if I have a problem, why am I being put into jail and not getting treatment? But again, pay attention to the message. And then you have, of course, around that 1984, you have, Nancy Reagan, who says, just say no to drugs, right? It's this whole anti-drug campaign that's going out. And then in 1986, Reagan signs the Anti-Drug Abuse Act of 1986. So what does this mean? This means that $1.7 billion was put into fighting the drug on war. Okay. Remember what I said. Pay attention to the narrative. So now you have individuals who unfortunately are struggling with substance use, and they're saying, I need help. But yet we're putting 1.7 million to fight the drug on war. So what did this do? This increased, it created again a mass incarceration of individuals. Okay. And then you started seeing that there was so much of a discrepancy with crack cocaine and powder. All right. So people who were carrying crack cocaine, even if it was 5 milligrams, if somebody had powder that was, 100 milligrams, the person who had the crack cocaine was getting 3 times longer incarceration time than somebody else. Well, let's talk about that a little bit more, right? When you have an individual's crack cocaine is cheap, the powder is not cheap. Do you see what I'm saying? So what population, the low income population, which is unfortunately a lot of, not all, but a lot of Black and brown communities are stricken with poverty. Okay. But addiction doesn't care about poverty. Addiction doesn't care about any of that, as we all know on this, this live. It doesn't care about that, right? It cares about feeding the addiction the need. Okay. Does all that make sense? Because I get kind of excited with this. You got any questions?
No, absolutely. I was more recently, I was involved with some of the advocacy in New York City to repeal the Rockefeller Laws. Actually, my ex-husband was incarcerated under those mandatory minimums, low-level drug offenses,
Yes.
but he was a white male, for the amount of drugs he was caught with. If he was a person of color, he would not see the light of day.
Right.
So I just remember those like 25-year sentence, mandatory minimums, and life sentences for low-level drug offenders, people of color.
Right. Absolutely. Absolutely. So then, right, I did a little bit of, digging, just a little bit, not too much, but I went into, now, according to the United States Sentence Commission, May 2002, cocaine and federal sentence policy. Okay. And this was a report to Congress, because you have good people out there that's saying timeout. There's a discrepancy. We need to kind of come up with a different system, because this, is causing people to be in jail 3 to 6 times longer for crack cocaine. So you have them, go to Congress and say, no, we need to come up with a different plan. But it was a vote in May 1st, 1995. And if anybody on here, if you want to research it later, definitely do that. The report is really interesting. I'm not going to go too much in details, but on your free time, definitely do it. So there was a vote 4-3. So Congress actually was like, okay, let's look at these guidelines, right? But unfortunately, the president signed legislation disapproving it. Okay, so the amendment of that was not able to be done. And so the suggestion was, well, why don't you come up with some recommendations and guidelines? And we can look at this again. So they did. They came up, they looked at it, they did empirical studies. There was, a lot of people from the scientific field, the medical field, law enforcement, people who work in this, area was they got a lot of data. And unfortunately, again, it just really sat and nothing was done about it, even in, 1997. So you still have such a huge discrepancy. And then if we go into May 1994, you now have where, unfortunately, Bill Clinton did the 3-strike law. So now if I have 3 offenses, okay, I am going, again, back upstate. So again, the narrative, pay attention to the narrative. My information, I gave you the citation of it, also comes from the United States Department of Justice archives as well, if anybody chooses to kind of look at that. So that's the narrative when you have a population that's dying and need help because substance use is just rampant, okay? The government says it's going to be what? The drug on war, public enemy number 1. And then you have legal consequences instead of treatment. Make sense? All right.
Yeah.
So let's look at the other narrative now. in the 1990s, what happens? Pharmaceutical companies start to say, "Hey, here's opiates. You can't get addicted with it." Oh no, absolutely not. You have all of these doctors, and I do believe firmly that the doctors, in their heart, they definitely wanted to help their clients. Okay, they really wanted to help their clients. But unfortunately, as we all know on this thread, addiction is very insidious, and it's huge. So then you go into 2017, okay? This information is the U.S. Department of Health Human Services, as well as the National Institution on Drug Abuse, as well as SAMHSA, okay? Now, 2017, what happens? The epidemic becomes declared a public health emergency. Remember, drug on drug on war, or war on drugs, public enemy number one. Now it goes to no. That's not what the drug is at all. No. It actually is more of a public health emergency, and we now need to provide some strategies of how to combat the opiate crisis.
And
Now, unfortunately, go ahead.
and it's no longer a moral failing. It's now a chronic health condition, and it's identified as a disease.
Exactly. Guess what? That means more funding goes into treatment services, prevention services. Do you see what I'm saying? So now we have a significant amount of money going into federal and state funding. You have the huge promotion of Narcan. You see what I'm saying? Now, my Black and brown people have been dying from heroin overdose for years. You see what I'm saying? Years. But all of a sudden, there's this huge push for Narcan advocacy. And unfortunately, it's the narrative. Pay attention to the narrative.
Right. And the other, Patrick made a good point. During the crack cocaine epidemic, what you saw in the media were Black people, and they were portrayed as criminal and violent and super criminals, right? Super predators was the word
Yes.
used.
Yep.
And today you see my face, right? And you see middle class, rich white families advocating. And what a big difference, right? What a huge difference in the narrative.
Right, absolutely. And so then you go into, why is it that Black and brown people don't trust a treatment system? Why is it hard to engage with treatment? Well, treatment has always been associated with, I'm a criminal, I'm a monster. And as Patrick said, yes, you see it, just Google it. Google it or YouTube it, and you'll see these big tanks going into, Black and brown communities. It was just horrific. So absolutely. I was reading what his comment, more of his comment. This is so awesome. I love it. So again, remember, the war on drugs was mass incarceration. Public health really equals to, it's a disease, like you said, and it's treatable, and we need to figure this out. Okay. And when you see messages on TV, now you see sometimes, unfortunately, grandparents having to raise their grandkids, right? Well, guess what? In the Black and brown community, grandparents have always had to raise, because this has been an issue. You see what I'm saying? But it's a little bit more sympathy, a little bit more of how do we help, and just that being empathetic now as opposed to years ago. Any questions or thoughts?
No,
I feel like I'm talking a lot.
I'm just listening. I just find, just so important to talk about this and to share with the community. I would say, looking at our data, we have a community that's predominantly Caucasian. So getting this message out to more and more of the recovery community, right? The recovery community as a whole, but also those folks that just don't know and, need to educate themselves. So I think this is, crucial conversations to have.
Right. And the other thing, that's also, when you start talking about, so I was looking at some research on, it was just really comparing Black and brown people going into the emergency room and reporting their pain. it actually was devalued. And so it showed that a lot of the doctors did not believe that, the Black and brown people were experiencing that. And it was looked at more of, okay, you're drug seeking. So to a certain extent, it actually was, it could have been, a little bit of a benefit in this way to be Black, is that you're not getting these high prescriptions, and prescribe this. It still doesn't take away from the fact of the illegal substances, as well as, fentanyl and so forth. So I wanted to point out something, because I was also looking at SAMHSA. They did an excellent article. It is called "The Opiate Crisis and the Black African American Population: An Urgent Issue." Now, the recommended citation for this year is 2020. So this is recent, okay? It is looking at nationally. And what it stated in here is that Black African Americans drug overdose death between 2015 and 16 was 40% compared to the overall population increase of 21%. Very interesting. You see what I'm saying? I want to point out something else in this report. This report is really good because it gives some strategies too. So if you have time, anybody out there, look at it, because it is very interesting. It also stated, I'm sorry?
I'm going to look up the link now and post it in the chat so people have access to it.
Perfect. Now, what it also stated is that in 2017, okay, non-Hispanic Blacks, the opiate-related overdose death rates was 12.2 deaths per 100,000 people. Now, that's the third highest. The first highest is non-Hispanic whites at 19.4. And then you have non-Hispanic American Indian Alaska Native, 15.7. And then you have the Black, which is 12.9, percent. What I also thought was interesting is that it stated from, which was very, very, very interesting, is that from 2014 to 2017, the death overdose for the Black and brown community, and of course in here it says non-Hispanic Black, I'm just saying Black and brown because I'm so used to that, it actually, for synthetic opiate, it increased by 818%.
Wow.
That this was the highest for Black and brown people compared to any other race. So right now we have, again, you have the narrative of rural white individuals that suffer from substance, which they are. I don't want to devalue that. Nobody should have to suffer for this, okay? But what you see is more of a focus on treating that population, as opposed to you see the increase of Black and brown people who are dying from this substance use.
Yeah, and it's, not diminishing anyone suffering from substance use disorder, but acknowledging the fact that the system has systemically wronged people of color as they suffer from substance use disorder, sought out help.
Right. I see one of the questions on here. What's interesting with the question, right? I would say yes and no. So is, do Black and brown people fear being labeled, but do they actually adopt them on themselves? When if you grow up and you're consistently told that you're not good enough, at some point you start to believe it. And as you can see just nationally what's happening with Black and brown people with the police, with Black and brown people with the discrepancy with health, do you realize that African Americans was given syphilis? So why would we want to come seek medical attention when you're giving us syphilis?
Right.
See what I'm saying? So, and research was done on Black and brown individuals. So why would we be as connected with it? We would feel a little bit more comfortable within our own community. So I would say yes and no to that question, but I would say it really is a systemic issue. It's not a one person, issue. It's not the fact that Black and brown people have so much negative, perceptions of themselves, but it really is a systemic issue that we're unfortunately dealing with. Yeah. And it's the, mistrust of the healthcare system.
Right. Yeah, that and the healing is coming from within the communities. I know there are healing circles, emancipation groups, because the system, the healthcare system, law enforcement, DHS, DSS, the entire system has failed, and there's that lack of trust. So the communities really are coming to heal themselves, I would say. I don't know if that's accurate, the right word.
Yeah, well, when you have, see, this is the thing with treatment services. Unfortunately, not all treatment services, when you come in, they say, we're going to pay attention to the holistic. We're going to do holistic treatment, right? But if you have a program that's not talking about racial issues,
Mhm.
for whatever reason, how is it holistic? Because that may be something that I'm struggling with. How many individuals, clients come in and maybe they're late for their appointment, or maybe they came in and they're snapping at you, and they get labeled as the angry person, or they always have an attitude. But has anybody ever stepped back to say, what happened to this person? You see
Right.
what I'm saying? And did this person just get stopped by the police? And they're trying to come out of that fight or flight mood.
Hmm.
You see what I'm saying? Because it takes time to transition from that. But you got to be at a clinic or appointment at a certain time. And you got to kind of get yourself back at a place where you can be present, if you can even be present. And so then you have even professionals, you go into professional therapists, even with us, we go into organizations and we have to code switch. So I may be talking to my friends and I may be like, hey, what's up? How you doing? And so when I go into a meeting, I may say, oh, hi, how are you doing? And I have to switch up my whole personality, because other than that, I may be looked at as the angry Black woman, because you have these multiple stigma and implicit bias that unfortunately people are not focused on and they're not dealing with. And I
Hmm.
told you the story, before. I have a really, really, really good friend. I, love her dearly. And, we kind of call each other work sisters, so, you have the work husband, work wife. So we're like work sisters. And do you know that she was paid, and I won't tell the name or the organization, I don't think that's appropriate, but do you know that she was paid $5,000 more than I was paid? I have more experience, and actually I helped in training her. And she had just came out of school, and she was paid $5,000 more. When I confronted my supervisor, the conversation was, you guys shouldn't talk about salaries.
Wow.
The other thing, right? And so the other thing I experienced with the same, my same friend, who like I said, I like to call her my sister. We went into a professional organization and I was dressed professional. She was dressed professional. We had our ID badge on us. Do you know that they stopped us at the door, made me go through the metal detectors, and told her, go ahead and proceed. And she did not have to go through the metal detectors. Now, she's very I like to say she's very protective of me. She
Mhm.
don't, if anybody knew her would know, she's like, absolutely not. You can't do that.
Very passionate.
She's such a social justice heart. And so she was going like, wait a minute, time out. Why is it that she has to go through? And I had to kind of calm her down, because all I kept thinking in my head was, oh man, she's going crazy. If we call the police, I may get locked up. I got to calm her down, because she was so angry at how I was treated. And again, I'm professional, dressed professionally, communicated professionally, have my ID. And again, I was up against stigma.
And it's really important to understand these aren't isolated incidences. This is happening every day, everywhere, right? And you're in a professional setting. When you told me that story, I haven't been able to stop thinking about it. I mean, there are no words. It's just unacceptable. And then to have fear of using your voice to stand up for yourself, because what if I end up going to jail? What if the cops come? Um, it's just not okay.
Right, right. But I think what sometimes is very difficult is that this has been going on for years, and now people are just starting to see.
Mhm.
It's I'm thankful that white people are seeing, because when we talk, when black and brown people talk, people don't hear us.
Mhm.
You see what I'm saying? But when white people talk, they get much more of a response. Again, pay attention to the systemic issues. I often say, even on my Facebook page, stay woke. Pay attention to what you're seeing.
Mhm. Yeah, and I wonder too, and I'm by no means, I'm a listener. I want to learn. I want to um, help in any way that I can. But I wonder if, and I could be totally wrong, and please correct me, white people are so upset about this because they are just seeing it, where this has been going on. So to like us, it's this, oh my God, what do you mean? What do you mean this is happening? Where this is a daily reality. This hasn't changed. It's been the same way.
Mhm.
And the other thing I think about, and again, I could be wrong. I try to like do my best to educate myself, but I don't have the experience. I just can't know. I don't know. But white voices, even in the Black Lives Matter movement, drown out the voices of the people of color. It's just something I've seen. And again, I could be wrong. I don't know if that's accurate, but I just see so many white folks screaming about what we need to be doing, and this isn't right, and this, that, and the other thing. And it's kind of like, are we taking over a movement that's not ours to take?
So I think that that's going to be different perspective from different people. Okay, the Black Lives Movement is very powerful. You see what I'm saying? But one of the things is that we need all voices to talk. It's not about all lives matter. It's about all voices talking about the injustice and the systemic issues.
Mm-hmm.
You see what I'm saying? So when we start getting into, am I overshadowing or stepping over the boundaries, or not allowing maybe my black colleague or friend to have a voice, you know what I'm saying? We then start moving from what the focus is. The focus is that we need everybody to be angry enough that they're going to vote appropriately. They're going to be angry enough that they're going to go to their employer and they're going to say, we need more black and brown people in executive leadership positions. When
Mm-hmm.
you look at boards members, a lot of board members for companies are all white.
Yeah.
You may be lucky if you find one, maybe two black individuals on those boards. Who's making the decisions in these organizations? Do you see what I'm saying? People want to do their research. For me, I have at this point, I have committed to not affiliate or to not spend my money at Starbucks. It's a second racial issue that they did not target it correctly for me. Do you see what I'm saying? So for me, I'm not going to invest my money into that. What do we need? We need all people to talk about what is the issue and stay on that. That it's not there's something wrong with you and you wasn't raised right. It's a systemic issue. You were brought in, and unfortunately, remember what I said earlier. You're getting these messages. When you get these messages on the TV of a happy, white picket, house, is generally a white family.
Mm-hmm.
You see what
Right.
I'm saying? Pay attention to what happened. St. John Fisher, when the statue was destroyed, right? What did we see? We saw those two individuals in their St. John Fisher athletic gear, not a mugshot. But then when you go to black and brown people, you see mugshots. Pay attention again to the narrative. Does that make sense?
It does. It does. I
So
haven't
again,
seen that
I'm sorry,
before.
say that again.
I have not paid attention to that, but when you bring that up, that's so clear.
Mm-hmm.
It's
You
so.
know, it's important because we get multiple messages, and it's even when we are younger as well. I happened to just pick up a kid book, and you know how you have one of those kids book and you connect the dots, you write the letter A and the letter B or numbers, and then you have the facial expressions for happy and sad, and the kids have to identify so they can hopefully identify what emotion is associated with what. So I
Mhm.
happened to pick up this book, and what I found, which was very interesting, and again, if you don't have your lens, focused on this, then you're not going to see. Well, guess what? Guess what I saw? I saw a white kid with a happy face, the black kid with the angry face. So
Wow.
those are messages. Now, when I mentioned something, somebody came back and said, "Oh, you're reading too much in it." Again, you're sending messages out. Whether you realize it or not, messages are being sent out. Why do you go to Wegmans? They say don't go to Wegmans hungry. Why? Wegmans is very good with tapping into the psychological area of people. And so when I go into the store and I see a whole bunch of chocolate, that's my addiction. So what do? You better believe I'm probably gonna put one of those chocolate bars in my bag.
Mhm.
See what I'm saying? Like there's studies of how to pull people in. You gotta pay attention.
Right. Yeah. Thank you so much for just coming on. I know it's uncomfortable for many white folks to talk about this stuff, and then there's this perception that um, we're just how do I put it? Like failed and wrong, and thank you for kind of clarifying that it's not necessarily me, although I'm contributing, right? I've been contributing my whole life, but it's been ingrained generationally. And we need to change the language, the system, it's so much more than just being educated. It's one thing to educate and say you support the movement and equity and all these things, but it's a whole other piece to take action.
Right. Right. And understand that white privilege is huge,
Mhm.
and so it's difficult as a black woman to have a conversation and I hear somebody say, well, no, that doesn't really happen. And or the white privilege doesn't happen where even, there's been research that have been conducted on even applications.
Mhm.
When people look at resumes, for example, and they look at the name,
The name and the
sometimes you have individuals who names are more of an ethnic, name, and they get overpassed, looked over when it comes to different positions. So I say, in the recovery world, what I love or what I at least fell in love with recovery is that when it comes to addiction, I want to actually change what I just said. What I fell in love with addiction field, is that it doesn't discriminate.
Mhm.
Addiction does not discriminate. It doesn't care if you're rich. It doesn't care if you're poor. It doesn't care if you're black, white. Heck, you could be red. You can't be red, but you know, um, it doesn't care. It kills, it steals, it destroys people's lives, and it creates a whole bunch of pain for people and their loved ones and their family members. And it also at times leaves a lot of unanswered questions.
Yeah.
You know what I'm saying? So that's, I believe, one of the main reasons why I went into this is because when I talk about addiction, it doesn't discriminate. Treatment services has to deal with implicit bias. Recovery programs have to deal with implicit bias. But when it comes to addiction, it kills.
Mhm.
So I say to your audience and people out there, you know, talk to your employers, find out who's at the decision making tables, go out and vote. Do you see what I'm saying? Read more information. I had two books I wanted to kind of share real quick. One of the books is, and this is done, it's an older book, but it is a really good read and it helps to put a lot of stuff in perspective. And you'll see information on here as far as like education, health disparities, as well as like redlining, which was really looking at housing. I
Mhm.
won't go too much into that, but it's called The State of Black Rochester 2013. And I'm just going to hold it up. I don't know if you can see it,
Mhm.
but this is the book. Now, you have local experts who also wrote this book. You see what I'm saying? So Wade Norman, he's one of the authors. Clayton Osborne, he's one. James Norman. You see what I'm saying? So it's a whole bunch of contributors who wrote this book. It's an excellent read. It puts a lot of things in perspective for you. So I would say read that. And for therapists,
Mhm.
all right, if you're a therapist, one of the things that I would tell you to please read to understand a little bit more is a book called Post Traumatic Slave Syndrome. Okay, and I'm going to put it up and you see the doctor's name and everything. This
Mhm.
is a excellent, excellent, excellent book. Okay, and it talks about a lot of what has happened with Black and brown people in history and slavery, and how we still are dealing with the effects of it.
And I'm going to put the links to the SAMHSA article as well as the two books in the comments after this feed, so everyone has can easily access and purchase them.
And then, of course, I wanted to mention, because we talked about this earlier, the last book is White Frigidity. Get
Mhm.
that, read it. It's important for people to just educate themselves.
Mhm. Absolutely.
I don't see any more questions.
No,
Is the time up? Did I talk over the time?
no, this is just this is, like I mentioned, your platform, I think probably would speak for everyone to say we're just in awe of you, and just listening and taking everything in. I know, you mentioned something really important, that addiction doesn't discriminate, right? It's a common disease. Lo and behold, it's a common disease. Why isn't the treatment, the recovery, the solution the same?
Mm-hmm.
And I know from outreach, we were doing some outreach in just the North Clinton area, and what we saw is priority was always given. And this is not, I don't want to blame any one system. I won't talk about the names of the whatever. Priority was given to IV heroin users, and if you had someone that was a crack cocaine user, which majority were people of color, they didn't have the same access. There's not a medical visa. They couldn't get in right away. They were given an appointment a week away. Um,
Mm-hmm.
it just continues to say, like, what people are valued, where people are worthy of treatment, which is, it's criminal. It's just criminal to have to send someone away because we can't, find a place for him or her to go. Really based on the color of their skin, right? Or tell
Right,
them they have to lie. I'll admit I've told them that before. Just
right,
to get to a safe place.
right. And in those there's a lot of people who see it. And
Hmm.
so I would encourage you to have courage to talk about it,
Hmm.
and to tell your, people, whoever it is, whether it's the employer, whether it's the community, whoever it is, tell
Hmm.
them that it's unacceptable. Use your voice,
Right.
because that's really, I will say, when you use your voice, be prepared that you may have some backlash.
Yeah. Yeah. I wonder if a follow-up to our discussion is having a panel with individuals, people of color seeking that have sought out substance use treatment and their experience in getting the help that they need. Um, to hear from them, to really shed more light on what it looks like in substance use disorder treatment and recovery for individuals of color.
Yeah, that's definitely, I know there's been a lot of people speaking out,
Yeah.
are in telling their Black experience. The only thing, just as a therapist, my therapist lens always comes in play, and I always say, just make sure you can put that person back together. So
Right.
make sure they're at a good place, even in their recovery, because some of these issues are it's just so hurtful. It's just so hurtful. And it's a lot of pain that's associated with it. And it's difficult, and so it's, if I can give like another quick example, how there's a sticker for the safe zone area?
Mm-hmm.
Well, there's no safe zone area for Black and brown people.
Yeah.
Do you see what I'm saying? So, that's where you have, of course, we have our community, as you mentioned, some of the circles that are being started to talk about these issues and concerns and the pain that we have experienced. So, yeah, I just, if you create a panel like that to share, definitely have action steps of how people can advocate and talk to these organizations,
Mm-hmm.
about changing some of their practices. Because you have some organizations that they do excellent work. I have to be honest, they do excellent work, but they don't realize that what they say to you is, they'll say to you, do you have any kids? But they'll say to me, how many kids do you have? Well, that taps into implicit bias. Why do you assume that I have children? Or they'll say to you, oh, What do you do for a living? Did you go to college? And for me, did you graduate high school?
Mm,
So it shows little covert, you see what I'm saying, implicit bias that sometimes we don't even realize. And they're even also on our documentation.
mhm.
So hopefully I didn't take it off of what you said. But yeah, I agree with the candle.
No, I wonder, and thank you for that feedback. That's really important to not leave people with like open wounds, right? That have worked so hard to recover. And I'm wondering if I could, I know in your free time as you're working and working on your doctoral degree, is this your fourth chapter? Fourth?
My fifth chapter, the last chapter. If I
Yeah.
had more here, I would be pulling it out more.
Oh my, I just commend and admire you. I've one of my friends is going through a doctoral program, and I swear every time I see him, he's closer and closer to an intervention.
Right? I've had a lot of my friends had to talk me off the ledge. I'm like, I'm done. I'm not finishing. I'm throwing the
Yeah, my head is so off to you. That's incredible. It's not something I could ever do.
Yes, you can. Are you kidding me? Look what you created.
It's kind of by accident. um, but
You know,
I'm,
the other thing, if I could just mention, I think that what would be helpful, even with, recovery, is to be able to link with organizations within the community that focus on Black and Brown, concerns and issues. So I know I've always loved the fact that, you guys go into the schools and do workout. I mean, I just love that, right? We have a city school district. Talk with them. You see what I'm saying? They're revamping some things, and see how can you guys be interjected, and there's other programs that are doing, fitness, yoga and, stuff. How can they also be incorporated? And we partner, with them because there's quite a few in Rochester. So partnering with the community. One of the things is that for the Black and Brown community, even though people may be looking at our community and saying, oh, it's dangerous, or, oh, have their own negative views about it, you got some awesome, incredible, talented people.
Mhm.
You know what I'm saying? And it's a lot of people in our community who we can go to for advice. They let us know about resources we can talk to, and get a lot of TLC love.
Absolutely. Here's Liz. Liz is pretty incredible. Um, Coping mechanism, absolutely, for dealing with racism and many other isms.
That's good.
Absolutely, absolutely. And to shout out some of the organizations that I'm aware of in the community is, Liz works closely
Can I
with.
just interrupt you real quick? Because before you said that, I wanted to kind of address that, the isms, right? I agree with this response. I just want your audience to pay attention to it as well. What tends to happen when people start talking about racial issues, people start wanting to add in other issues. And then the racial issues become at the bottom of the list. So when you talk about racial issues, you know what I'm saying? Focus on that and not all other issues. All other issues are very important. So please don't misinterpret what I'm saying, because it is very important. But what consistently happens is it gets overshadowed with other issues and concerns.
Thank you. Thank you
I
for
just
saying
really
that.
wanted to kind of point that out, but I agree with your, with your member. I absolutely agree with it, but just wanted to kind of throw in that.
Thank you for highlighting that. Absolutely. Thank you for that.
And what was the organization?
Oh,
Sorry.
Imani is incredible. She runs Yoga for a Good Hood,
Oh,
and it's
does
an
she?
incredible organization. They do yoga training and scholarships. You probably know Karen, Exercise Express, has a pretty incredible fitness related program for people in need. Those are just a couple that I know of that are really incredible, do great work in the community.
Awesome.
Absolutely. Yeah.
Awesome.
Thank you, April, so much. I just appreciate your authenticity, your honesty, your willingness to come in and talk about disparities and racism, as a whole. I really value you and your feedback and your input, and maybe I could connect with you in your free time to ask. some guidance on a panel and some next steps.
I would love to. Thank you so much, and thank you to your audience. And before I leave, I just would like to, just say to everybody, I appreciate being able to be here, but also remember, this issue is not your issue. It's a systemic issue. Don't take it personal.
Mm-hmm.
Don't take it personal because you move off of what the message is. It's a systemic and structural issue that was created, and it is working very well. But what we have to do is we have to interrupt it if we're going to start seeing, a reduction of the injustice that we're seeing in our world. So again, don't take it personal.
Yes.
Stay with what the focus is. It's a systemic issue.
Thank you. And again, I'll post the resources. You mentioned the couple of books, the website, and some action items of how we can create change for the Black and Brown community and in the movement as a whole.
Thank you so much.
Thank you, April. Have a wonderful rest of your day, and I just admire you so very much.
You're so sweet. Thank you again.
Thank you.
Bye-bye.
Bye.
Bye, everyone.
Bye. Thank you so very much, April, period. I know when I end the broadcast, it just kicks us both out of the quote studio quote, period. I just wanted to say how much I appreciate you, your words, guidance, and your message. Hi, I was just about to call you. What's that? Oh no.